Welcome back to our podcast with Vantage Hospice, Our Way of Caring. Today we're going to actually talk with Brandy. Brandy and I are going to have a little conversation and hopefully answer some of the frequently asked questions about hospice and give you guys some more information. So here we go. All right. So the first question that we have is, what is hospice care and how does it work in Houston and at Vantage?
So hospice care is a level of care that is provided to anyone who has a life-limiting illness. The guidance from Medicare says that a patient has to have 6 months or less. However, patients who come on hospice oftentimes are on service longer than 6 months. We provide overall care to the patient wherever they call home. So it can be a private residence, a skilled nursing facility, assisted living, personal care home. Sometimes the patient is in an inpatient unit for hospice. So across wherever someone lives is where we provide care. It includes having a nurse go out and assess the patient, make sure that all of the symptoms that a patient could be experiencing at the end of life are well palliated, or for lack of a better word, we want to make sure that the patient is comfortable. And then we also have a team of people who support the nurse and the patient through that entire process. That includes a social worker, chaplain, hospice aide who assists with ADLs or bathing and overall hygiene. Sometimes volunteers assist the families if they need a little bit of a break and need to get out. The volunteers provide companionship. They do various tasks to enhance the patient's life at the end of life.
So in Houston, I mean, it's a unique environment because we have a really large coverage area. So at Vantage, even though we have a centralized office here in the Galleria area, we have pods of teams in each area so that we have quick response times and we're able to make sure that your needs are met really quickly.
I think one thing that's important to add, we have pods of care teams throughout the city. A great advantage that we do have is that we also have associate medical directors who are typically really vested in those communities. Like on the southeast side of town, we have a medical director who lives in that community, works in that community, north side of town, so on and so forth. So it really is, we cover a large area, but each pocket of town has their own style and way of doing things. These doctors know these patients in these areas and they tailor the needs of care to those communities specifically.
One of the biggest benefits of having a centralized office and doing the pod approach is everything that goes on in the organization comes through our office, the central office, and Brandy and I are very much aware and involved in making sure that everything is resolved if anything needs to be resolved, and that we're dealing with any issues or problems as they arise, not going through a corporate kind of structure to get that stuff done.
The other thing, our managers are also here in the office, so there's a lot of collaboration. Although each part of the city has different dynamics and styles and ways that they do things, there's a centralized approach and philosophy of care. So at the end of the day, our goal as an organization is to make sure that we're meeting families and patients where they are and providing hospice in a way that's going to be meaningful to them. So we really try to individualize that plan of care for each patient and family. So the expectations of a family that, for example, that lives in Alvin may differ from someone who maybe lives in the Woodlands. So individualizing the care to meet the individual needs of each patient and family and expectation.
The next question we're going to discuss is, how do I know when it's time to switch to hospice care? And that's a tough one. That's a very tough one. Do you want to start?
I think the best way to say it is each patient needs to select the most appropriate level of care for them when they deem it fit. A patient can have a life-limiting prognosis, 6 months or less. However, if the patient and family are not ready emotionally, spiritually to accept a more palliative approach and a less aggressive approach to care, sometimes the timing is not appropriate. So you can be clinically appropriate for hospice, but you're not emotionally ready.
Agreed.
Part of what our team does, and I think that we do a really great job, is recognizing that. So we recognize this is a difficult decision. We want to figure out what their goals are and how do we align with their goals. We provide them with education. There's no pushing from our organization for patients to come on service. We believe in our service, and I think the care speaks for itself, but the patient and family has to be ready.
I think one of the things when we're talking about determining when you're ready for hospice and when a loved one is ready for hospice. It's having those conversations with the patient and with other members of your family. Everybody doesn't have to be necessarily on the same page in the book at the same time. But if you're having those questions and you're thinking, gee, is this really what we want to do? What's the plan? That's the time to have the conversation. Doesn't mean you have to make a decision today to do that, but you really should have that conversation and be willing and maybe open to hearing different things.
I would also say the physicians who partner with us understand that it is a difficult decision. So sometimes the referrals are made earlier than later, just so we can begin having those conversations and help families decide between treatment options. So although the doctor or the treatment provider recognizes this family is really not ready right now, but it would benefit them to have the information so when the time comes, they have had that seed plan about what the next steps might look like for the patient.
Exactly. I think it's also important to talk about the fact that hospice is not giving up.
Yeah.
It's not giving up. Hospice changes the focus of the trajectory, really, of the illness. We are focused on comfort. We kind of shift hope. We don't take away hope. I mean, we still are, we want you to experience everything that you want to experience and be as comfortable as you possibly can while you're doing that. The focus is really on quality of life and making sure that you're meeting all of those milestones and things that you want to do.
And that's defined differently for each patient and family, right? So quality of life and comfort is individualized.
Absolutely.
So what I deem comfortable or quality may differ for you.
Exactly.
So again, having those very frank and transparent conversations with the patient and the family is important. Also, a lot of times, the patient needs to be given permission to have those conversations. Sometimes we often hear, well, we don't want to upset mom with the H word, but sometimes we need to give permission to mom, dad, or whomever that is to have that very frank and transparent conversation.
Exactly. And just a little bit of a news flash. They already know. That's the other part.
They're living in their body.
They're living in their body, and they know when something is not right. And they may be waiting for you to open the door so that you can have those conversations and ask those questions. Yeah. So it really is a gift to give somebody to talk with them honestly and transparently about what's going on with them and not, keep it.
It's interesting that you say that it's a gift. Because one of the true gifts of hospice, absent from just the palliation of symptoms, it really helps families focus on the things that really matter.
Agreed.
So unfortunately, when folks understand that life may be limited, shifting and saying, you know what, I don't want to do that anymore. And I don't have to. I want to do this because this is important to me.
Exactly.
Or you know what, I may not be here next year for Christmas. And we've always talked about doing Christmas in Disney World, for example. Let's do it this year.
Yep.
And how do we make that happen? And how does hospice support that?
Exactly.
So there are many things that hospice provides in the way of a gift. And I think that's one of the biggest gifts that hospice can provide.
So comfort is, like you said, individualized. So we talked about that earlier. And some of the things that hospice does, it's not just morphine and Ativan. There's a focus on trying, like for congestive heart failure, for example, if you're having a lot of edema, we do work on maybe elevating your legs to make sure that you're able to walk if they're really swollen.
We do a lot of things, honestly. So when we talk about comfort, a lot of things that people do towards the end of life is going to a lot of appointments, sitting in waiting rooms, doing things that are uncomfortable to a patient who might have some type of chronic pain issue. So God forbid you're sitting in your doctor's office for 30, 45 minutes waiting to be seen. You're in the room for another 30 minutes, and then you're waiting to be checked out for another 20 minutes. That's not necessarily comfortable. We provide all the care in the home. So we come to you, we bring your medications to you. Our field team comes to you in your home environment. If you needed an x-ray of some type, we do that in your place of residence. So comfort is not having to go out and do these uncomfortable things and being in your own home environment. Of course, we provide medications. If a patient needs supplemental oxygen, we do that. If you're having periods of shortness of breath, So there are a multitude of things that we do to ensure that the patient is comfortable. But again, that is all very individualized.
I think another thing that we also do, maybe not comfort-wise, but we try to make people happy. So if you are a diabetic and you've been on a diabetic diet for the last 20 years and all you want is a piece of chocolate cake, go ahead and eat the chocolate cake.
Yeah.
If you don't want to take your diuretic anymore, you don't have to. So the focus is really on the patient. It's patient-centered, and you call the shots. So you let us know what you want to do. Of course, we're going to give our opinions and let you know kind of the risk versus benefit.
Yeah.
But ultimately, the decision is yours, and we want to support whatever decisions you have.